Did you know that colon cancer is the second leading cause of cancer deaths in the United States? It claims thousands of lives each year, yet many people are unaware of the warning signs that could help them catch it early. Early detection is key, and recognizing the symptoms could literally save your life. In today's video, we're going to dive deep into 8 colon cancer symptoms you should never ignore. Whether you're young or old, these symptoms are vital to watch for. Even if you think you're healthy, colon cancer can develop silently, with little to no warning. Stick around until the end, because knowing these signs and taking timely action could make all the difference in protecting your health or the health of a loved one. Let's get started. Symptom 1. Blood in stool. One of the most common early symptoms of colon cancer is blood in the stool. This can be alarming, but it's often dismissed as something minor, like hemorrhoids. However, bright red blood in your stool, or dark, tarry stools, could indicate bleeding further up in the colon. The bleeding is often intermittent, meaning you might not see it every time you go to the bathroom. This is why people tend to overlook it. Don't assume that blood in the stool is harmless. While there are other potential causes, such as ulcers or anal fissures, colon cancer should always be considered. If you notice any blood, even just once, it's critical to talk to your doctor immediately for further evaluation. Symptom 2. Unexplained weight loss. Losing weight without trying might sound like a dream come true, but when it happens unexpectedly and quickly, it could be a major red flag. Unexplained weight loss is often a sign that something is wrong inside the body. In the case of colon cancer, this occurs because the body is struggling to absorb nutrients, or the immune system is working overtime to fight the disease. If you lose more than 5 to 10% of your body weight in a few months without any lifestyle changes, like diet or exercise, you should consider it a warning sign, especially if paired with other symptoms on this list. Symptom 3. Persistent abdominal pain or cramping. Everyone experiences stomach pain from time to time, but persistent abdominal pain or cramping could be a warning sign of colon cancer. This type of pain is often described as crampy or sharp and is usually located in the lower abdomen. In early stages, you might feel intermittent discomfort, but as the tumor grows and blocks the bowel, pain becomes more constant. If this pain is accompanied by bloating, gas, or changes in bowel habits, don't wait. Talk to your doctor right away. Symptom 4. Changes in bowel habits. Colon cancer can significantly disrupt your digestive system, causing sudden and unexplained changes in your bowel habits. If you've noticed constipation lasting longer than usual, or if you've been having diarrhea that persists for weeks, it could be a signal that something is obstructing the colon. Pay attention to thin or ribbon-like stools. This could indicate that the passage through your intestines is being narrowed by a growing tumor. The key here is recognizing any lasting change from your normal bowel routine. Occasional digestive issues are common, but persistent changes should never be ignored. Symptom 5. Fatigue and weakness. Feeling unusually tired all the time? Fatigue and weakness are common signs of many health problems, but when it's constant and overwhelming, it might be related to colon cancer. Cancer cells drain the body of energy as your immune system fights the tumor. Additionally, colon cancer can lead to anemia, especially if there's hidden bleeding in the digestive tract. This lack of red blood cells reduces the amount of oxygen circulating in your body, making you feel exhausted, even after a full night's sleep. If your fatigue doesn't seem to improve and is paired with other symptoms, consult a healthcare professional. Symptom 6. Anemia. As mentioned earlier, anemia can be a direct result of internal bleeding caused by colon cancer. When you have fewer healthy red blood cells, you might notice symptoms like pale skin, dizziness, and shortness of breath. This internal bleeding often goes unnoticed because it happens slowly over time. But if you're frequently tired, look paler than usual, or experience shortness of breath, especially during everyday activities, get checked out. A simple blood test can reveal anemia, which might be an early warning sign of colon cancer. Symptom 7. Rectal bleeding. Rectal bleeding is another alarming but often ignored symptom of colon cancer. This refers specifically to blood coming directly from the rectum, and it's more noticeable when wiping or on the toilet paper. Bright red blood is usually from the lower part of the colon, while darker blood is from higher up. Even though it can be linked to conditions like hemorrhoids, persistent rectal bleeding requires immediate medical attention. The earlier you catch it, the better the chances of successful treatment. Symptom 8. Feeling of incomplete evacuation. Another subtle but important symptom is the feeling of incomplete evacuation. After a bowel movement, you may feel like you haven't fully emptied your bowels. This uncomfortable sensation is caused by a tumor obstructing the colon, making it difficult for waste to pass through. Many people mistake this for a minor digestive issue, but if it persists and is accompanied by other symptoms, it's critical to get checked out. Don't brush it off. Early detection saves lives. So, there you have it, 8 colon cancer symptoms you should never ignore. Remember, early detection can make all the difference in treatment outcomes, so if you experience any of these signs, don't hesitate to seek medical advice. It's always better to be safe than sorry. If you found this video helpful, please like, comment, and subscribe to the channel. We're committed to bringing you valuable health information that can truly make a difference in your life. Hit that notification bell so you never miss out on our latest videos. Thanks for watching, and stay healthy.